Now that you have that report, you're going to be taking a look at that data and you're going to be investigating or researching what is there in that report. So step one, you access the CASPER system and you brought up your review and correct report. You've reviewed the data that you found there. Step two, you reviewed that data and now you have some questions. The performance data for a specific open quarter, it doesn't look right. So you're going to now run process and or outcome tally reports to help you to research or investigate the data that makes the basis for that report. If you identify information that you believe is either missing or incorrect, you can now submit new or modified assessments because the data correction period is open. Your last step is to now go back and access the review and correct report the following week to verify that the information that you have submitted has gone through and that the updated performance is now visible. This is a multi-step process, and we want to go through this one step at a time to be sure that you are clear about what you're going to do and how to do it. Step one, you're going to run the process and outcome tally reports for each open quarter so that you can look at patient level measure results, not agency level, patient level. This is available in the OASIS Quality Improvement CASPER report category along with the review and correct report itself. In that process outcome tally report, you're going to go through and identify and review those patients who did not trigger the measure and therefore were not included in the numerator. Remember when we first looked at the slide that had the review and correct report data spread across? And I pointed out to you that in that one the numerator was 30, but the denominator was 37. So in that instance, you had 7 patients who did not trigger the measure. The measure results should be the same or similar between the review and correct report and the tally report, depending on when the reports were accessed, and we're going to talk a little bit more about that momentarily. Report data is updated at different intervals. This is where it can get to be a bit confusing. We want to make sure that you understand how the frequency of the calculations and the updating will affect what you are looking at. The review and correct report data is updated once a week. So the calculations are done once per week on a Monday. The tally reports, these calculations are updated twice a month on the 2nd and 4th Saturdays. And you can see that these intervals do not match exactly. After the close of each review and correct period, the data from that period will be frozen for the purpose of calculating the measure. That means that no additional changes to any of the assessments from that quarter will be reflected in the publicly reported measure values or in the information available in on-demand CASPER reports. This is why it is so important for you to closely monitor your review and correct reports to be sure that all the needed corrections, including resubmission of assessments, are made while that quarter is still open. So bear in mind the intervals, that they are not identically matched up, and you're going to be looking at your data with that thought in mind. Tally report corrections are done twice a month, as I said, 2nd Saturday and 4th Saturday. There are some distinct differences in those calculations. Let's take a look at that. 2nd Saturday of the month, new OASIS records with a completed episode of care. Remember the definition. A completed episode has both SOC or ROC and transfer, death, or discharge OASIS. So a completed episode of care that ended during the month that is 3 months before the calculation month. For example, the April 14th calculation includes those records with a completed episode of care ending in January 2018. So the completed episode of care ended or had a transfer, death, or discharge OASIS that happened in January of 2018. On the fourth Saturday, new modified or inactivation OASIS records with a completed episode of care that ended during any previously calculated month. In other words, on April 28th, the fourth Saturday, a calculation will be done that includes all records with a complete episode of care ending in January 2018 or prior to that. Do you see the differences between the two different sets of calculations, one on the second Saturday and one on the fourth? Now that we've talked a little bit about the research or investigation process, I'd like to take you through some examples of exactly what happens when you see something that doesn't look quite right and how you respond to it. Here's our first example. We're going to go through this step by step. On Monday, April 2nd, 2018, your agency accesses the Review and Correct report for quarter 1 2018 data that has been added to the report up through 4/1/18. You have questions about the quarter 1 2018 measure performance rate that is showing. It doesn't look quite right to you. So now you're going to run the applicable processor outcome tally report for quarter 1 2018. Remember, the measure performance rate is agency level data. The applicable processor outcome tally report is patient level data. So now you have that tally report. You can now look at the individual patient outcomes for the measure in question. You can identify which patients did not trigger the measure, and now you can look into the charts to see if this data is correct. You check the accuracy of the submitted OASIS data for those specific patients who did not trigger the measure. Was that in fact the correct answer? On Wednesday, 4/4/18, your agency now submits modified OASIS assessments to ASAP if in fact you found errors in that OASIS data. By Monday, April 9th, the next Review and Correct report calculations are done, and you would now be able to see those changes. You access the Review and Correct report on 4/9. You review and confirm that the measure performance rate has in fact been updated for quarter 1 2018 based on those modified assessments you submitted on 4/4. That allows you to make that correction if in fact an error is identified. On the 28th of April, that's the fourth Saturday in the month, the next tally report calculations are done. So if you go back on the 30th of April, the following Monday, and access the applicable tally report for quarter 1 of 2018, you can now confirm that the patient measure outcomes that you had identified as potentially incorrect in the earlier report have now been updated based on the modified assessments that you submitted. I know it seems complicated, but if you follow the steps, one step at a time, through the different reports, through the different time periods when corrections are made, you will see that that is how the process works, and it does allow you to update the data if you need to. Here's a calendar. Some of us need things that are more visual, and I appreciate the calendar very much because I'm one of those people. I prefer to see the report dates spread out this way. Whichever way works for you, you do want to make sure that you are fully aware of when the different data reports are updated and become available to you so that you can always access the most current data. Because this is complicated and it's difficult to follow, let's take another example and walk it through, again, slowly and carefully, so that you can see how it falls together in sequence. For this example, we're going to look at modifications that were made late in the month. We'll begin with a Monday, April 23rd. Your agency goes into the CASPER system and accesses the Review and Correct report. You now look at that report and you have some questions. Quarter 1, 2018 measure performance does not look quite right to you. You have some concerns. That's agency level data. Now you go in and run the applicable process or outcome tally report for quarter 1, 2018 to look at patient level data. You review the individual patient outcomes for the measure in question. This enables you to identify which patients did not trigger the message, did not trigger the measure, so that you can now take a look into those records. Your agency now checks the accuracy of that OASIS data for the patients who did not trigger the measure by doing an intensive chart review and reviewing the OASIS data that was submitted. Perhaps you identify one or more OASIS assessments that need to be modified. So April 26th, you now submit those modified OASIS assessments to ASAP, assuming that you found and can support the need for data correction. On the fourth Saturday, April 28th, the next tally report calculations are done because that's the fourth Saturday in the month. On Monday the 30th, the next Review and Correct report calculations have been done. So on Monday the 30th, your agency goes back in, pulls up the Review and Correct report, and you can confirm that the measure performance rate was in fact updated for quarter 1 based on the modified assessments that you submitted on the 26th. Last step, go back in and now pull up the applicable tally report for quarter 1 of 2018, and you will now be able to confirm that the patient measure outcomes were also updated based on the modified assessments you submitted on the 26th. Here's your calendar again, showing you step by step each of the things that you did on those appropriate dates. Is this getting clearer? I hope so. It took me a while, and I've been at this for a long time. Make sure, take the time, go back through these slides specifically, and follow the process step by step. Let's do one more. What happens if you identify and submit modifications after the quarter was closed? Let's take an example. On Monday, August 20th, the agency accesses the Review and Correct report. They review that report very carefully, and they identify that they have some questions about quarter 1, 2018 and the data that they're seeing. So they run the applicable process or outcome tally report, the patient level data, for quarter 1, 2018. They identify and review the patient outcomes for the measure in question. They determine which patients did not trigger the measure. They check the accuracy of the OASIS data that they had submitted for those patients they identified who did not trigger the measure and therefore were not included in the numerator. On Thursday, August 23rd, they submit modified OASIS assessment data for those patients to ASAP, assuming that they have in fact reviewed the chart and they are certain that incorrect data had been found. So now the correction deadline for quarter 1 2018 was actually August 15th. And you have submitted that modified OASIS data on August 23rd. No further quarter 1 2018 review and correct report calculations will be performed because the correction deadline has already passed. When you go, the next tally report calculations will be done on August 25th, the fourth Saturday of the month. On Monday the 27th, the agency goes back and reviews the review and correct report. The measure performance rate was not updated for quarter 1 2018 based on those modified assessments. Why not? Because the correction deadline was August 15th and the modified assessments were submitted on the 23rd. Therefore, the performance rate was not updated on the review and correct report. On Monday the 27th, the agency also pulls up the applicable tally report. They confirm that the patient measure outcomes were updated based on the modified assessments. Here's your calendar. If you keep track of the dates and what reports are being calculated and updated at what intervals, you will be able to get your data modifications in on time before the deadlines close. There are other reports that you will find very helpful to you in doing your research or your investigation to identify whether or not errors have occurred. There is a report called the OASIS Error Detail. It's located in the CASPER Agency Provider Report category. You request this by date range, and it will show you a completed list of all the errors encountered in your assessments that were submitted during the date range that you have specified. It tells you by assessment ID whether the error was a warning or a fatal error. Assessments with fatal errors are not accepted into the database. They cannot be included in the quality measure calculations. This is what that report looks like. Again, you want to be sure that all of your agency information is correct, as I said earlier. I know that the print is very tiny here, but you want to be sure that you are looking at what the error is, what type it is, and whether or not it was a warning or a fatal error. You should be looking at this possibility on a regular basis each time that you submit OASIS information the first time. As you do the assessments and you submit your OASIS to the system, you need to be running your validation reports to confirm that your OASIS has been submitted successfully and that there were no errors. If you do this on a regular basis at the beginning of the process, you will have many fewer OASIS errors to be corrected at this point in the process. The OASIS Assessment Print Report is also located in the CASPER Agency Provider Report category. You request this by the assessment ID, which was shown on the final validation report. It shows you all the values that were submitted for that assessment and makes it much easier to quickly identify what values were submitted for which items as they were included in the quality measure calculations. This is an example of what that report will look like.